Hello everyone. In this video, I am going to discuss about the available treatment options for managing such a clinical situation. You all would have come across such clinical situations in your practice. Let's discuss about such a case in this presentation. One of my wonderful subscriber has sent me a radiograph of a 38-year-old male patient who has reported with pain. This is the radiograph of mandibular, left second molar and third molar. We can observe in the radiograph that there is an impacted third molar and there is a proximal decay which is close to the crown of the impacted third molar. So looking into the radiograph, I thought of creating a digital image of the same case. So this is how most often I present my cases to my patients so that they can better observe and understand their clinical situations. So we can see the radiolucency in the second molar is quite extending subgingival. You can see that it is quite close to the bone level or maybe below the bone level and below the gingival region, and there is a radiolucency with a bone loss below the crown portion of the third molar, and there is a widening of apical region of the second molar. It all implies that there is a pulpal involvement of the decay in the second molar, and also the third molar is impacted. So in this clinical scenario, what are all the treatment options that will come into our mind? The first treatment option could be extracting the third molar which is impacted and also the second molar because of the extensive decay, because of the bone loss and maybe the pain of the patient. Okay, the second option could be to remove the second molar, which is looks like the tooth which is reason for the pain, and we can leave the third molar expecting that it to come to the place of the second molar in the future, or maybe we can attempt to save the second molar and we can remove the third molars. Let's see about that. If you are attempting to remove the second molar and the third molar, we can plan for some implant procedure. Looking at the cost and the ability of the practitioner to place implants, yes, that may be a viable option, but there is a saying that the implant are only for the placement of the missing tooth. It is a rehabilitation procedure where implants are placed to replace a missing tooth. Is it a wise option to remove a tooth which could be saved by other treatment options and replacing with implant? It might not look like a very good treatment option. So the other option is to extract the second molar and expecting the third molar to move into the position of the second molar. Looking at the age of the patient, which is 38 years old, and look at the root completion. So the root is almost complete. So after completion of the root, we cannot expect a third molar to migrate to the position of the second molar and coming into the occlusion, and which is quite almost horizontally impacted. So that treatment option is also not a viable treatment option. So the last treatment option is we have to attempt to save the tooth. So is it possible to save the second molar and remove the third molars? Let's see what are the steps that we have to perform. I say this treatment option and I will always go for this third treatment option of removing the third molar and saving the second molar, because I have done hundreds of cases like this and I almost always end up with a 100% success. So the first treatment option, the plan to proceed with this case is not to remove the third molar on the first. So in the first appointment, we may have to remove the decay as maximum as possible, and we have to do an emergency management by doing a cleaning and shaping. So in the next appointment, we have to remove the third molar. After removing the third molar, and maybe within a week, there will be a shrinkage of the gingiva close to the distal surface. In this area, we can expect the gingival margin to shrink, and we will be able to appreciate the distal margin of the tooth. So in these areas we can better appreciate it. So once we could see that area better, we can remove the remaining decay and we can restore it with some restorative material. So I always prefer to restore these areas with resin modified glass ionomer cement, or we may go for procedures like deep marginal elevation. So it might be little time consuming with a cautery or maybe the local hemostatic agents. We will be able to control the bleeding, and it is not a technique sensitive procedure to restore this. So after restoring that, we can proceed with continuation of the root canal treatment, and we can finish root canal treatment and we can put a permanent coronal restoration. Before that, placement of a post is mandatory because the decay has extended subgingivally, and because maybe the second molar, there will be lot of occlusal load which will be applied during mastication in such teeth. So it is always essential to go for a post of your choice, a metal prefabricated a metal post or a fiber post. Depending upon your choice, you can go for a post placement, and after that we can go for a full coverage restoration. We can go for a crown. So if you can do this procedure, we will see that the margin of the crown is going to be in the restoration. Do you think that a restoration can support a margin? Yes, a well done restoration can support a restoration provided if the restoration is more than 2 millimeter. If the restoration is, the thickness of the restoration is going to be lesser than 2 millimeter, then the restoration may fracture or it may start cracking. But if the restoration is more than 2 millimeter, definitely the restoration will stay there intact without any trouble. So once this restoration is done and a crown is placed, so we can appreciate that there will be a complete healing of the tooth which will happen, and we can expect a good success rate. So that's all about that. This is my treatment options or my treatment planning, and if you have an alternative treatment option that's what you follow in your practice, you can put in the comments. Let's have a healthy discussion in the comment section. So thanks for watching, and thank you for asking opinion for management for such a wonderful case, and have a nice day.